First, I'd like to say thank you, Dr. Morante, for helping me pass the ANCC exam. I did take the Flex crash course. I did the question banks, and the one-on-one was super helpful, especially with the fast facts that were provided. I'd like to thank you, Dr. Morante, for being such a supportive preceptor and mentor throughout my process. Your knowledge and experience and compassion are top-notch, and I'd recommend you to anybody. So again, Dr. Morante, thank you so much for being so supportive, and I am thankful that you were my preceptor, and the classes that you provided were very informative and really helped me to pass the test. So I just wanted to say thank you.
Thank you to Dr. Morante for always being my cheerleader. His live review class was very informative, and the Q banks were hard that they honed my critical thinking skills and strategies for test taking. Dr. Morante has been very supportive, and his wisdom was always on point. Thank you for everything, Dr. Morante and PAS-NP, for helping me pass my ANCC PMHNP certification exam.
I passed! Thank you so much, Pedro Morante, for everything. For your mentorship during all of my clinical hours in my DNP program, for the PASS course that allowed me to have the confidence to excel at the PMHNP ANCC boards the very first try.
Remember your 2-2-1 rule, okay? All those questions that are difficult, sometimes they are non-scored, so don't stress about it. You should be great, and always trust the process, enjoy it. You're gonna be gonna be creating an impact to the community. Remember, it's not just to pass, but also to lead by example, to create an impact to the community. We're gonna celebrate tomorrow because you're gonna be a psych mental health nurse practitioner board certified from the Bay Area, California.
Oh my God.
Congratulations. Did you pass your board today? Wow.
The exam was very tricky. Some of the questions on your review was there. Good luck to the rest.
Yeah.
Okay, guys.
Attended our live class too in LA, right? The one in Koreatown.
Yes, I was in live class.
That was our live class. Congratulations. There you go. Lady Lou from California. Psych Nurse Practitioner Board. So proud of you from being my student to colleague.
Thank you, Dr. Morante.
Now, psych.
You guys,
board practitioner.
Dr. Morante is really amazing. He lets you be very independent, and you're gonna use a lot, because not a lot of preceptors would allow you to like do hands-on with patients. And with Dr. Morante, it's like one of the best trainings I've ever had, because I learned how to create my care plan, and then just give he would give input if you're doing the right thing or not. So that was really good.
Wow, that was me.
That was you. It's like deja vu, right? All right. Wanna welcome each and everyone, especially all the pastors out there. Special shout out to my wife and the kids. Just wanna put it out there. Welcome to PMHNP Lock It In Live, DSM-5 night with Professor Leddy and, of course, Professor Pedro Morante. Good evening, everyone. Wherever you are right now, please stay engaged and welcome to the PMHNP Lock It In Live. So tonight we are locking it in one of the most important areas of the PMHNP boards and clinical reasoning. It's called the DSM-5 Diagnosis and Differential Diagnosis. Tonight is not just about memorizing the symptoms, Letty. Tonight is about learning how to think like the board exam. We are going to break down key DSM-5 patterns, the buzzwords, timelines, exclusions, and do not miss differences between commonly confused disorders.
Yes, welcome everyone. I'm Professor Letty, and we are so excited you're here with us for our DSM-5 night. So, tonight, we want you to stay engaged, participate in the chat, answer questions, and ask your own questions during our Q&A. This is a safe learning space. Whether you are just starting your PMHNP journey or preparing for the board soon, this session is designed to help you build confidence and clarity.
Great. And before we begin, a quick reminder for each and everyone. This live review is for educational and board preparation purposes only. It is not intended to replace clinical judgment, supervision, formal education, or current clinical guidelines. Also, participation in this review does not guarantee exam outcomes. Our goal is to help you strengthen your understanding and test taking strategies.
So, tonight, get your notes ready, type your answers in the chat, and prepare to lock in the DSM-5 mindset.
Right. Let's begin with our team tonight, right? Symptoms tell the story, but timeline gives the diagnosis.
Mm,
And just a quick reminder, we're having a special class on July 7th, right? Make sure,
Yes,
guys,
yes.
July 7th till July 10th, right? 9 a.m. to 10 a.m. Pacific Standard Time, domain 1 to 5. And then we also have our July 25th, 9 a.m. till 3 p.m. Pacific Standard Time, 1 day last minute prep, 6 hours, the ultimate preparation course that you guys will have on those two. If you follow our study formats, you'll be able to pass your boards on the first try. And if you struggle with test taking strategies, anxieties, that's why we're here for you.
Yeah, if you go ahead and would like to purchase the bundles, it's really helpful. You do the domains 1 to 5 or July 7 to 10, and then the 6 hour last minute prep. It's very high yield. It only focuses on things that we think is really going to come out of the board exam. You go ahead and scan the QR code um, and you save $50 from both the bundles. And if you haven't, go ahead and purchase our study collection. We have the clinical concepts, the psychopharmacology, and Rise with Pass. If you are already a new grad, you already passed the board exam, the psychopharmacology and the clinical concepts are really, really helpful while you're starting your practice. And then if you want to avail of the discount, it's just use the coupon code PASS10. And then for those who are joining us on Facebook, YouTube, Instagram, and LinkedIn, if you haven't registered yet, please make sure to scan the QR code on your screen because we're gonna have a raffle. So registration is required, okay, to be eligible for a raffle drawing at the end of the day session. So don't miss your chance to win. Scan, register, and join the fun. Hello, welcome everyone.
All right. Welcome, everyone. Wherever you are, please type in your name and where you guys are tuning in from. We have some Philippines audience and some East Coast and West Coast from the last 4 weeks that we've been doing this. So we're so glad to have you here. So, setting the DSM-5 mindset. Remember, when you see a DSM-5 question on our board exam, always remember, do not panic. It's part of your domain number 3. So the exam is usually asking you to identify a pattern. So the key is, what number 1, what are the symptoms? How long have this been present? Number 3 is, what is the level of impairment? Is there a substance, medical condition, trauma, grief, or a developmental factor that is involved? And most importantly, what diagnosis fits best for your patient?
Exactly. So for PMHNP board exam, you must look for the best answer. Okay. Sometimes they give you like tricky choices, so you have to find the best answer, not just an answer that sounds familiar to you. So many questions would usually include overlapping symptoms. For example, anxiety can show up as PTSD, right? OCD, panic disorder, social anxiety, and adjustment disorder. Sometimes just one word, just the duration, or just one number could actually change the entire diagnosis. So be careful with that. So the question usually becomes what makes this diagnosis different from the others?
Thank you, Letty. And that is why tonight we will focus on those differential diagnoses that we have. We are going to look at the clues that help you separate one disorder from another. I just remember during my time that I was able to do this exam, that I was differentiating between acute stress disorder versus post traumatic stress disorder. So we're going to break it down for you. Is it a major depressive disorder? Is it a bipolar disorder? Is it bipolar type 1 or bipolar type 2? So that's why we're here to guide you and simplify it and give you guys the ultimate tools that you need to pass the board exam.
Yes. So, okay. So also, a simple board strategy that I can use, when reading a DSM-5 question, underline or mentally highlight timeline, or say when you're taking the board exam, you will be given a piece of paper and then a pen. So if you are when you're reading and if you want to find keywords, what I would do is I would write it down. Okay, look at the timeline. Okay, duration, weeks, months, days. Okay, is there any trigger? Is there any stressor? Okay, what's the main symptom pattern? It was recurrent. Does it come when it goes? That it comes with psychosis? Does it happen only when during depressive state? So functional impairment. Is there any functional impairment? Is the patient or the person able to execute their activities of daily living? And then you do your rule outs.
3 days, 2 weeks, 1 month, 6 months, or since childhood, pay attention to those keywords, right?
Mhm.
That timeline may be the key to your diagnosis.
Okay, so for example, another example I can think of, very high yield. Acute stress disorder occurs after trauma and lasts for 3 days to 1 month. It makes it different from PTSD because PTSD is more than 1 month. So after a trauma exposure. So remember, find a trauma, find the stressor, find a trigger, and then look at the duration, look at the timeline. Okay? Adjustment disorder occurs after a stressor but does not require trauma exposure. Most of the time, adjustment disorder happens like divorces or situation, moving to a new city. So that could be something that you will consider adjustment disorder. Brief psychotic disorders, it lasts at least 1 day but less than 1 month. Right? Schizophreniform disorder lasts from 1 to 6 months, and schizophrenia lasts 6 months or more. But you can easily identify schizophrenia when when the patient is not able to execute their activities of daily living. There is functional impairment.
And remember, Lady, we are preparing you guys not only to pass your board exam, but actually to apply this later on with your clinical practice. How the board is thinking is that they want to make sure that you are safe and entry level to practice. So you want to make sure that you have a correct ICD codes and CPT codes. Later on, you don't want to undercode, overcode. That's like a red flag, and that is how the board exam thinks. The exam labs timeline too.
All right. Okay, so I think we're gonna go ahead and start. Before we proceed with doing our usual questions, we're gonna break down some differential diagnosis. We're gonna go ahead and start with PTSD and acute stress disorder versus adjustment disorder.
All right, so let's start with trauma and stressor related disorders, right? If the patient experienced trauma and has intrusive memories, nightmares, avoidance, hypervigilance, and negative mood changes, think about PTSD or acute stress disorder. But the timeline matters.
Yeah, so if symptoms occur after trauma and last 3 days to 1 month, think acute stress disorder. If symptoms last more than 1 month, think PTSD.
Correct. And adjustment disorder is different, right? The stressor may be serious, but it does not have to meet the trauma criteria. The patient has emotional or behavioral symptoms after a stressor, but the full criteria for another disorders are not met.
Yeah, so for your board pearl, remember this. Trauma plus less than 1 month, it's ASD or acute stress disorder. Trauma plus more than 1 month, that is your PTSD. I need you to write this down. Stress
Correct.
reaction without full trauma criteria, it's adjustment disorder. Okay?
So once again, remember those three, okay? Acute stress disorder, post-traumatic stress disorder, adjustment disorder. The timeline is really important. Trauma plus less than 1 month, acute stress disorder. Trauma plus more than 1 month, PTSD. Stress reaction without full trauma criteria, that will be your adjustment disorder. Remember
Yes.
that.
Yes. And another topic, high yield, major depressive disorder versus your bipolar disorder. Okay? Let's talk about depression. So, a patient may present with depression, low energy, poor sleep, poor concentration, guilt, and suicidal thoughts. But before diagnosing major depressive disorder, always screen for a history of mania or hypomania. Okay?
Yes, that is very big on your PMHNP board, Pearl. So if the patient has ever had a manic episode, the diagnosis is bipolar 1 disorder. Even if the patient is currently depressed. If the patient has hypomania plus major depression, then think about bipolar 2 disorder.
Mm-hmm. Yeah. So, board pearl, okay? High yield. Mania is bipolar 1. Write this down. Please write this down. Hypomania plus depression, bipolar 2. Depression without mania or hypomania, that will be your major depressive disorder.
Great. And remember, antidepressant monotherapy in bipolar disorder can increase the risk of mood switching. So always assess for mania. Always want to go back to your nursing process, assess before diagnosing, before intervening, before evaluating, and then you go back again. It's a cycle. Add pi, assess, diagnose, plan, implement, evaluation. That will be your task taking strategy.
Yes. And next, let's talk about your schizophrenia versus schizoaffective disorder versus mood disorder with psychotic features. A lot of students actually mistake this. They're very close to each other, but you really need to find those keywords, okay?
Sure, this is one of the most commonly confused topics, and we're going to apply that later on the question. So, a simple rule to diagnose this, right? So, if psychosis happens only during a mood episode, think about mood disorder with psychotic features. So, if psychosis persists at least 2 weeks without mood symptoms, think about schizoaffective disorder. But if psychosis is the primary issue and mood symptoms are brief compared with the total illness, then think about schizophrenia. We're going to
Yeah.
apply it in the question later on. Okay.
Yes. And then, so write this down. Psychosis only during mood symptoms. That is your mood disorder with psychotic features. Psychosis for 2 weeks without mood symptoms. It's schizoaffective disorder. While psychosis that dominates mood symptoms are brief, schizophrenia. Plus, with functional impairment, that is your schizophrenia.
Okay. Remember that 2 weeks without mood symptoms clue is a major board exam questions that we need to make sure to master. So don't confuse yourself.
Okay. Next, we have your OCD versus your OCPD or your obsessive compulsive disorder versus your obsessive compulsive personality disorder. Okay, so OCD involves obsessions, compulsions. So the patient usually recognizes the thoughts or behaviors as unwanted or distressing. This is called ego dystonic.
And OCPD, on the other hand, is your personality disorder. So the patient sees their perfectionism, control, and rigidity as appropriate part of who they are. So they're usually ego syntonic.
Okay, so for your bird pearl, write this down. OCD, they would usually say, I hate these thoughts. I hate it. This is very stressful. That is your OCD. But OCPD is, they would accept, oh, this is who I am. I'm just very rigid. So it's not very distressful. It's not very stressful for them.
Great. I think they're ready for the question
Question.
and answer portion.
Okay,
Next
perfect.
slide, please.
All right. So let's go ahead and discuss question number 1. So, a 34-year-old paramedic witnessed a fatal bus accident 3 weeks ago. Since then, he has had nightmares, intrusive memories, avoids ambulance calls, is hypervigilant, has insomnia, and has missed work due to fear of returning. What is your most likely going to be your diagnosis? Letter A, generalized anxiety disorder. Letter B, acute stress disorder. Letter C, post traumatic stress disorder. Or letter D, adjustment disorder with anxiety. Look at your keywords. Fatal bus accident. What is that? 3 weeks ago. Type in your answer on the comment box.
Yes, remember a minute per question, maximum of a minute and 30 seconds. Do not spend 10 minutes in one question, guys. You're going to run out of time when you're taking your board certification. When you're not sure about the question, you can flag it out and go back or go to the next question and you can come back. But remember, test anxiety needs to be managed. You got this. Trust the process. DSM-5, here you go.
Okay, I think they got the answer right. The answer is letter B, acute stress disorder. Why? It's only 3 weeks. Remember that. So this patient demonstrates classic trauma-related symptoms. Bus accident, that would be your trigger. 3 weeks, okay? So it includes intrusion, avoidance, negative mood, and hyperarousal. The distractor is that the symptoms strongly resemble PTSD. However, they have been present for only 3 weeks. If you change 3 weeks into like 3 months, the diagnosis will change, okay? So what is the exam really asking? Not what symptoms does the patient have, but more or so on how long have the symptoms lasted.
So always focus on the timeline, guys. And we're doing a great job on answering these questions. Remember, trust the process. Eliminate two options that are distractors. Always choose between two, and then always choose the best answer.
Okay. Right? So this is like your timeline. Okay. Look at that. Take a mental picture that breaks down your acute stress disorder and your PTSD. Okay, question number 2. A 39-year-old accountant reports excessive worry about finances, her children's health, work performance, and future events for the past year. She describes muscle tension, fatigue, irritability, poor sleep, and difficulty concentrating. She denies nightmares, flashbacks, avoidance behaviors, or any history of trauma. Which diagnosis is most appropriate?
Keywords are important. Remember that. When you look at which diagnosis is most appropriate, you're looking for an affirmative answer. When they tell you which diagnosis is not appropriate, then you're looking at a negative answer. Okay?
Okay, so is it A, PTSD? Is it B, generalized anxiety disorder? Is it C, acute stress disorder? Or letter D, panic disorder? Okay.
Remember, a minute per question, 1 minute and 30 seconds max, not longer than that. 5 minutes, 10 minutes. You're going to run out of time. You got this. Practice. The more you practice, the better your results going to be in your exam.
Okay, what's your answer? The answer will be letter B, your GAD, your generalized anxiety disorder. So their patient is anxious, as you have seen with the symptoms, but there is no trauma and no re-experiencing of the event. When you see anxiety, insomnia, irritability, and poor concentration, don't answer yet. Ask yourself, what is causing the anxiety? What is driving it? Okay? So, you guys having problem seeing? We can see it well from our end. Is that better? Is it better for everyone?
I think it's better. We can see it.
Okay.
Yeah.
Okay, next. Question number 3. Still looks the same? Yeah, YouTube is fine. If you're on YouTube.
Mm-hmm. Instagram, LinkedIn, we have
Mm-hmm.
different other platforms. TikTok, we're also live on those different platforms.
Okay. I think there's something wrong with the but you can go ahead and go to either YouTube, Facebook, there's
LinkedIn,
like LinkedIn.
Instagram Live.
Okay. Let's go ahead and proceed with question number 3. So, a 35-year-old man presents with 1 month of depression. His wife reports that last year he went 7 days sleeping only 2 hours nightly without fatigue, became unusually talkative, made impulsive purchases, and his behavior led to problems at work. Which diagnosis is most appropriate? This is tricky, okay? Letter
Mhm.
A, major depressive disorder. Letter B, bipolar disorder, bipolar 1 disorder. Letter C, bipolar 2 disorder. Letter D, persistent depressive disorder.
And I would like to emphasize on this one. Sometimes, guys, when you're taking the board exam, it can be NCLEX, FNP, PsycNP, or any board certification. Sometimes opposition is a very good strategy that you guys can do. When there are two options that are opposite, when one says decrease, one says increase, one says lower it down, or the other one says titrate it up,
Mhm.
one says number one and one says number two, then there could be an option like that that is opposition or negating. That's a good strategy that you guys can do. So when there are two options that are opposite, do your task taking strategy. One
Mhm.
of them could be the right answer. So let's take out letter A and letter D and choose between
Mhm.
letter B or letter C as a
Letter C.
strategy of negation.
Remember what we said earlier
Mhm.
about the bipolar 1 and bipolar 2? Remember that? Okay, and the answer is letter. It's only between B or C. It's letter B, bipolar 1 disorder. Why? Although the patient currently meets criteria for major depressive disorder, but if you look into further, right? Remember, when you're trying to assess for, you see patient is having signs of depression, you're gonna venture more. Maybe there could be something else. So you're gonna ask about your mania symptoms. Okay? History describes a manic episode characterized by decreased need for sleep without fatigue, pressured or talkative speech, impulsive behavior, like impulsive spending, marked functional impairment, or like placed or like affecting their work. So the answer was bipolar 1 disorder.
Thank you, Laddie. And always remember this, right? Bipolar 1, mania rules.
Mhm.
Bipolar 2, there is hypomania plus depression, but never mania.
Mhm.
Remember the differentiation between those two. Do not choose bipolar type 2 if the patient has psychosis, hospitalization, or severe impairment during elevated mood. That becomes bipolar 1. Remember
Mhm.
that, okay? Hot
All right.
topic. Past formula.
Yes. All right. So high ones, bipolar always. So yeah, we just need a one single lifetime of manic episode. So that establishes the diagnosis of bipolar 1. So this remains true regardless of the patient's current depressive symptoms. Okay. Mania rules for bipolar 1.
They're doing a great job, Letty. They have answered three questions, three in a row. Great
Yeah.
job. Keep on doing that. Remember, you have 175 questions to do for ANCC and 150 questions for AANP. I took both and was able to survive it. You guys will survive this exam.
Okay. Let's proceed to question number 4. A 29-year-old entrepreneur has slept 2 to 3 hours per night for 6 days, but reports feeling fully rested. How I wish I'm like him. He recently spent $30,000 on an unrealistic business venture and insists he is destined to change the world. What is the most likely diagnosis? Remember, 2 to 3 hours of sleep for 6 days. Okay. Is there impulsive behavior? Spending 30,000 sounds very impulsive, right? Okay. And some sense of grandiosity, destined to change the world.
Yeah, imagine you have
Yeah.
1 billion. If I have 1 billion, I think 30,000 is nothing for me. I could buy everything too.
Mm-hmm. Right. So let's break it down. Letter A, is it generalized anxiety disorder? No, it doesn't fit. Okay, it doesn't fit. Is it major depressive disorder? It was not mentioned, right? No signs of anhedonia, no signs of loss of interest, of volition. So it's between B or C. So the answer is letter C. Why? Remember, I said look at 6 days. Okay. The answer is manic episode. So the trap is high productivity. So the clues that makes this mania are decreased need for sleep, grandiosity, and impaired judgment, and reckless spending. So don't confuse sleeping less with needing less sleep.
Thank you, Letty. And just very important, when you're assessing for mania, guys, you wanted to rule out the medication history of the patient, right? Are they on
Mhm.
corticosteroid, right? Are they on certain medications like SSRI and they have bipolar disorder and that can cause them to have mania, right? So there are different angle that we need to look at it in order for us to rule out if what's causing the mania for the patient. And it's highly important to assess this, especially if you're on corticosteroids like prednisone, anything that ends with zone, right?
Yeah, so.
Hydrocortisone,
Mhm.
prednisone, methylprednisolone. So think about assessment of mania all the time.
And also, I was trying to point to you guys 6 days. That would identify if it's a mania or a hypomania, right? So hypomania only lasts for 4 consecutive days. If it's mania, it lasts for at least 7 days. So remember, your 4 is hypo, 7 is manic mania, okay?
Very good. Once again, mania severe lasts 1 week,
Mhm.
while your hypomania is less severe, lasts 4 days. And I also put it into the chat box for everybody that is confused. Please make sure to check out the chat box, and I will be giving you more tips as we go along.
There's a question. So psychotic features can happen with mania?
So
Dr.
for
Mark?
psychosis, yes,
Mhm.
mania
Yes.
will be more on the bipolar one. Do not pick bipolar 2 if the patient has psychosis or hospitalization during the elevated mood episode.
All right. So, all clear? Let's proceed to question number 5. A 34-year-old executive becomes enraged after receiving constructive feedback from his supervisor. He insists that the supervisor is incompetent, demands special treatment, and states, "People like me shouldn't have to follow the same rules as everyone else." He has no history of arrests, deceitfulness, or repeated violation of others' rights. Which diagnosis is most likely? Letter A, antisocial personality disorder. Letter B, narcissistic personality disorder. Letter C, borderline personality disorder, or letter D, histrionic personality disorder. Go ahead and put your answers on the comment box. This
Yes,
description reminds me of someone.
I do too. So make sure, guys, you guys are engaged. Please ask questions. Shout out to Kamala Kumilang from PNAA, Texas, Cameron County. Just very engaged on this session. Thank you so much,
Mhm.
Madam President.
All right. Okay, I think everyone got the answer. Does this remind you of anybody? We
It
would
may
know
be
at
your
least one.
ex. It may be somebody that you know or your neighbor, huh? Okay.
I have mastered this diagnosis because of someone.
As they said, right? Keep talking. I'm diagnosing you, as they said.
Yeah. Tell me more about it.
Yes.
Okay.
Yeah.
Answer is letter B, narcissistic personality disorder. So the key features, grandiosity,
Mhm.
sense of entitlement, they're important. They're more important than other people. The need for admiration. You need to admire them, They
Mhm.
feel good when you praise them all the time, and hypersensitivity to criticism. So that's what we call our narcissistic injury. So there is no evidence of chronic deceit, criminal behavior, or disregard for the rights of others. So that would not be antisocial personality disorder. So the answer is narcissistic personality disorder. Also
Thank you, Professor
remember,
Letty, for that. And a
yeah,
lot of our students got it correct. So remember, for your narcissistic personality disorder, they always think about me
me,
first.
yeah.
Letter M, they have magnified self importance. Letter E, they have a lot of entitlement. Letter F, they have fantasies of success or power. Letter I, they feel important, special, and they're so unique. Letter R, they require admiration. Letter S, they are so self centered. They lack
Yes.
empathy. And letter T, this is very wrong, takes advantage of others. And we need to make sure that they have grandiose sense of self importance. And that
Mm-hmm.
will be your keyword.
Yes. So they usually like, I deserve more, or I
Mhm.
don't care who gets hurt. They don't even feel guilty about it. So, oh, I'm sorry. Yeah, they don't really care about, getting hurt, but it's more like putting more importance to themselves because they think highly. They're on top of the world. They're the most important person in the room, right? Sense of entitlement.
Oh, and then some of you have answered borderline personality disorder. So for borderline personality disorder, we're focusing on instability, abandonment of fears, impulsivity, and self-harm, and also intense relationship. So you see them like what? Multiple cuts on their arm,
Mm-hmm.
and it could be very manipulative. So for them, you need to make sure you do dialectical behavioral therapy approach. You need to make sure also you are setting your boundaries, right? They can manipulate you. They will say, oh, I deserve a 1 hour smoking break, but the unit only says 30 minutes. So they're so entitled, and it comes to a point that they could manipulate you. So set
Mm-hmm.
clear, healthy boundaries, or firm boundaries. So those are your keywords, right? You don't want to be empathetic. You don't want to
Mm-hmm.
show sympathy for them. For borderline, if you watch Girl Interrupted, you'll see a classical symptoms there of your borderline personality disorder. Okay.
And also later on in practice, you would notice that these patients, if they can't get to you or manipulate you, they will jump from one provider to another. They do provider shopping. Very,
Yes.
very classic.
And always check cures, guys. If they're asking for like what medications that are highly controlled, so make sure check
Mm-hmm.
cures report, because they will be doctor shopping. They can go from Dr. Loot to Dr. P, Dr. M, and you
Mm-hmm.
really need to make sure you're on top of it. Okay. And there can also have staff splitting. Thank you, John,
Mm-hmm.
for emphasizing that too.
Okay. Good job,
Wow,
everyone.
we did 5 questions. So make sure stretch. Everybody, stretch your arms like
Okay.
this. After
Yes.
5 questions, it could be so tiring. So make sure you do your deep breathing exercise, and always tell yourself, I will be a psych nurse practitioner board certified. I got this. Positive
Mhm.
mindset, right? Close your eyes and then think about a beautiful place that you like to go. I think about Disneyland with my kids when I'm testing for my exam. That relaxes you, right? And then go back again for the next question.
Yeah. What I did is I would
Mhm.
pause for a minute and then close my eyes and imagine wearing a white coat and walking out of like testing center with a green check. That's how I did it. So always remember, do your deep breathing exercises. Okay. You need more oxygen in your brain, especially when you're starting to feel like, oh my God, this question is so hard. It's so difficult. But remember, most of the time, those very difficult, very technical questions are not even. Like if they're asking for percentages, if they're asking for like numbers, specific numbers, that's probably not scored. So don't panic when you see those questions, okay?
And trust me, make sure you control your anxiety. Test
Mhm.
anxiety is real. So once you get into the testing center, make sure you're confident and make sure you have a good management of your anxiety. Do not allow the anxiety to overpower you, or else your critical thinking, your capability to read the questions will be not so good. So make sure to focus, concentrate, make sure you give it all. Okay? After 50 questions, you feel like so tired, and
Yeah.
that is felt by anybody, right? Your stamina. That's why keep on doing practice questions, guys. We have a lot of like question banks that could help you uh, boost your stamina when you're testing. And make sure you're used to 175 questions or 150 questions for ANP and 175 questions for ANCC. You got this. Break it down.
Okay. Question number 6. A 34-year-old woman reports eating thousands of calories in one sitting twice weekly. She feels guilty afterward but denies vomiting, laxative use, fasting, or excessive exercise. What is the diagnosis? Is A, bulimia nervosa, letter B, anorexia nervosa, letter C, binge eating disorder, or letter D, other specified feeding or eating disorders? Go ahead and put your answers on the comment box. Okay. She feels guilty afterwards. No, denies vomiting, denies purging behaviors. That would differentiate this diagnosis from this diagnosis. Okay. Sometimes just one word.
Remember that,
Remember,
those keywords.
keywords.
Yes. Keywords are important.
Denies vomiting, laxative use, fasting, or excessive exercise after eating thousands
La-
of calories.
laxative use is there, guys. Laxative misuse. Always remember that. Vomiting,
Mhm.
fasting, excessive exercise. All of those are very important keywords.
Okay, I need everyone to read it again.
Yeah.
I'm seeing like wrong answers. So I need
Yes.
you to read it again. A
Yes.
34-year-old woman reports eating thousands of calories in one sitting twice weekly. Okay. She feels guilty afterward, but denies vomiting, laxative use, fasting, or excessive exercise. What is the diagnosis? Okay. The answer is letter Letter C, binge eating disorder. That's why I keep on saying denies
Mhm.
purging behaviors, denies vomiting, denies use of laxative or excessive exercise. Because if the patient is positive for purging behaviors, that would change the diagnosis. The diagnosis will become bulimia nervosa. But this one is binge eating disorder.
I agree with you, Letty, right? When you're testing for the board exam, guys, you need to make sure you know those eating disorders criteria, right? Binge eating disorder, they binge eat with loss of control, they feel distress, and usually weekly for 3 months and no purging. Okay? Remember that. No purging for binge eating disorder, right? What else? When you talk about patients with bulimia, you need to check their knuckles, guys. Okay, a lot of them will have a Russell sign. So why do they have a Russell's sign? Because they tend to what? Put their hands on their mouth, and then remember the hydrochloric acid can destroy the lining of the skin, and that's a classical symptom for your binge and purge cycle, which is Russell sign. And then that will be your bulimia nervosa. But if it's anorexia nervosa, a lot of Hollywood stars died from this. We know Karen Carpenters, and some are struggling with anorexia nervosa. They look at themselves in the mirror and they feel they're fat, but they're not. So think about amenorrhea and think about the presence of lanugo. Okay, remember
Mhm.
that they could have like what, hair
Thin
around here
hair.
or even their faces. So think about those classical signs and symptoms. If a patient has binge eating disorder, it's really important to think about the treatment plan for your patient. So there's like an FDA approved right now, Vyvanse 70 milligram could be a good option for you to help them prevent them from what eating out of control. So remember that if you are binge watching Netflix, right? That's
Mhm.
almost similar. You're finishing the entire series, so binging, and If there's no purging, then that will be your binge eating disorder. So once again, binge eating disorder, binge eating without purging. Bulimia nervosa, binge eating with compensatory behavior. Anorexia nervosa, low body weight plus fear of weight gain. So
Okay.
make sure you know the classical signs and symptoms.
All right. Question number 7. A 29-year-old patient presents with auditory hallucinations and paranoid delusions. Family members report these symptoms have persisted for the past 3 months, including several weeks when patient had no depressive or manic symptoms. So the patient also experienced a major depressive episode during this period. What is the most likely diagnosis? Tricky. Letter A, major depressive disorder with psychotic feature. Letter B, bipolar 1 disorder with psychotic features. Letter C, schizoaffective disorder. And letter D, schizophrenia. Okay.
Remember,
Persisted for
always do the process of elimination.
elimination.
Yes, when there are two options that are what sounds alike or
Mhm,
opposite, they could be the best answer. So remember, right, when you have like schizoaffective disorder and schizophrenia, sometimes
mhm,
it could will ring a bell.
mhm.
Will ring a bell like two of them are similar or opposite or negating. One of them could be the right answer, or one of them could be the best answer.
Okay. So the key question here is, does psychosis occur without a mood episode? So your answer is going to be letter C, your schizoaffective disorder. So if the question mentions like hallucinations outside of a mood episode, eliminate mood disorder right away, okay, with psychotic features. Because this one is going to be a different diagnosis. Yeah, Dr. Morante dropped there on the comment box. So for mood disorders with psychotic features, psychosis happens only during depression or mania. So schizoaffective disorder, psychosis happens with mood symptoms, but also continues 2 weeks without mood symptoms. So be careful with this one. This is very tricky. Sometimes I get confused with this too, and I have like to read it right away. Read it like 3 times to make sure. Okay, for you again, write this down. Mood disorder with psychotic features, psychosis only when there is mania or depression. Schizoaffective disorder, psychosis persists for more than 2 weeks without mood symptoms. And then schizophrenia, psychosis predominates mood symptoms are brief relative to the illness. Okay, again, timing is everything. Remember, master your DSM-5 criteria for each high yield diagnosis. Okay, this is heavily tested.
And that will be your best friend once you guys start practicing, guys. My DSM-5 book, make sure you guys have a copy of it. It's up to date. Make sure also remember psychosis alone for 2 weeks is a schizoaffective disorder. Okay, once again, you also want to make sure you know the differentiation between schizoaffective disorder, schizophrenia, right? For schizophrenia, what is the main neurotransmitter that could be
Mhm.
affecting the patients that is showing positive and negative symptoms? So it boils down to your neuroanatomy,
Dopamine
your
pathways.
neurotransmitters, and then make sure that on their neuroanatomy section, you know that if they have schizophrenia, they have enlarged ventricles, right?
Ventricles.
And that's very
Write that down.
important. Yes, write that
Write that
down,
down.
please. Put a star, put a
Schizophrenia,
highlight,
enlarged ventricles.
large ventricles. And also make sure you guys know the difference between a positive symptoms
Symptom.
and negative symptoms, right? Mesolimbic, positive symptoms. Mesocortical,
Cortic.
to cut something, that will be like a negative symptoms. Tubero and fundibular pathway, like a tube. I think we mentioned this at the last. There's a tube and a
Correct.
hormone. So that will be your prolactin level leading to gynecomastia and galactorrhea. And then also you have your nigrostriatal pathway, which is leading into your EPS. Thank you, Addie TL. Think they put it there. So I remember mesolimbic, limbo, ROP is positive. Mesocortical, cut, negative. When we cut something, it's going to be negative, right? Tuberoinfundibular pathway, tube, and a hormone. And then you have your EPS, nigrostriatal pathway. Okay?
Okay. Let's go ahead to question number 8. Oh, we're in our last 8 minutes. A patient
Wow.
insists everything be perfectly organized but enjoys the routine and sees nothing wrong with it. Which diagnosis is most likely? Letter A, obsessive compulsive disorder. Letter B, generalized anxiety disorder. Letter C, autism spectrum disorder. Or letter D, obsessive compulsive personality disorder. Test taking strategy, and we mentioned this earlier.
Yes.
You were paying attention, this will be an easy question.
Giveaway.
Yeah, it's a giveaway. Test taking strategy. You only have 2 options there. Letter A or letter D, right?
Remember,
What
when there are
teams?
2 options that sounds alike or the opposite, do the practice of your opposition, right? So take out letter B and let's take out letter C. Cross it out.
Mm-hmm. Yes, the answer is, of course, it's your OCPD or your obsessive compulsive personality disorder. So remember, your OCD is ego dystonic while OCPD is ego syntonic. So if they like their perfectionism, sometimes they say, oh, I'm a type A person, right? So OCD, they would say like, I hate these thoughts, it bothers me, it's very stressful. OCPD, meanwhile, is like, this is who I am. I'm accepting me. I'm being perfectionist. I'm type A. I like everything routine, habits. So I like everything organized. Actually, like high achieving people would have like OCPD, right? They like
Yeah,
routines. But it's not a disorder, can never be disorder because it does not really affect their activities of daily living. It's not stressful for them. I think everyone got it right. Good job.
great. So think about OCD when you see intrusive thoughts, repetitive checking, hand washing. Remember, they have a lot of dry hands. Contamination fears, unwanted thoughts, distrust by symptoms, compulsions, reducing anxiety. OCPD is perfectionistic, rigid. They're very
Mhm.
controlling. And I think everybody can relate this, especially a lot of nurses.
Mhm.
Workaholic. Shout out to
Mm.
all the nurses that are workaholic out here. OCPD, difficulty delegating. I think this is also one of the most common problems of nurses. Sometimes they don't want to delegate, they just want to do it themselves. And then preoccupied with rules or lease or order and believes their way is correct. And that could be harmful sometimes too if you have OCPD. And always think about that one. Another one is your pandas. I think I
Mhm.
just want to make sure and throw out there. What do we mean by pandas, guys? Just think about Panda Express. Pandas is pediatric autoimmune neuropsychiatric disorder associated with what? Streptococcal infection. Once again, pandas plus OCD is a pass formula. Once again, pandas plus OCD is a pass formula. So think about those patients that are exposed with strep infection and now they're asking whether kids are experiencing mania or OCD symptoms, and that's because of your pandas in correlation with your OCD. So a sudden pediatric OCD or tics after they have a strep infection, and we know the group A beta hemolytic streptococcus are part of that. So pandas, pediatric, abrupt OCD or tics after a strep infection. Pass formula. Please write that down. Thank you.
Write it down. Okay, let's go ahead and proceed to question number 9. A 10-year-old repeatedly argues with teachers, deliberately annoys classmates, refuses to follow rules, and frequently blames others for his mistakes. He has never been physically aggressive, stolen property, destroyed property, or violated major rules. Which diagnosis is most likely? A, conduct disorder. Letter B, disruptive mood dysregulation disorder. Letter C, oppositional defiant disorder. Or letter D, antisocial personality disorder. Look at the age. Look at the age. And
Thank you,
there's
Addie.
no, okay. Look at the age. Age is
Thank you,
10
La
years
Lola
old.
Maria. Larhanda Shanta. Mallory Lane, welcome.
Wow, welcome. We have like new people.
Camela from Texas, Cameron County. Deepika.
Answer is okay. Read it again. Okay. Is the child merely oppositional or are they violating the rights of others? That makes the conduct disorder and oppositional defiant disorder differs from each other. So for this case, it's oppositional defiant disorder. And I kept on saying, look at the age, 10 years old. Because once it becomes an adult also, and then it starts violating rules, and probably they would have history of going to prison, it's going to change the diagnosis. It's going to become what? It's going to be a different diagnosis. Okay, so ODD is defies. Okay, ODD defies pattern of angry or irritable mood, argumentative, defiant behavior, and vindictiveness. So towards authority figures, parents, teachers, but there are no serious violation of rules. Yes. So conduct disorder, this is delinquency, pattern of violating rights of others, or major age-appropriate social norms or rules. Examples, aggression, theft, vandalism. Once a conduct disorder moves into an adult, that becomes, yes, your antisocial, okay, personality disorder. And what is the last part of the brain that becomes mature? That's why adolescents or kids are very impulsive. What part of the brain? It's high yield. What part of the brain is the last part of the brain that would actually become mature? They are also responsible for aggressiveness, poor decision making. That would be your, yes, your prefrontal cortex. That's high yield. Good job, everyone.
So always think about that one, right? ODD defies conduct disorder, delinquency. ODD is arguing, defying, blaming, and anger. Conduct disorder is more severe. So they have aggression, cruelty, theft. They destroy the property, and even a serious rule of violations. So ODD, angry, argumentative, defiant behavior toward authority for 6 months without the serious rights violation seen in conduct disorder. But always think about behavioral modifications. So also involve the family,
Family.
right? So when you're treating this patient, guys, always make sure that the family is involved. If they're not going to school, they're not following directions, they skip classes, make sure the family is highly involved because that's part of the treatment plan in order for you to address these issues. Or else they're going to end up having an antisocial personality disorder later on. That could be problematic too.
Yes. Okay, are you guys ready for our last question? A
God.
20-year-old says,
Yeah.
I avoid meeting new people because I'm afraid they'll think I'm awkward. He reports having severe close friends in high school and denies childhood problems with communication, pretend play, or understanding social cues. Symptoms began after a humiliating public presentation 1 year ago. Which diagnosis is most likely? Letter A, autism spectrum disorder. Letter B, social anxiety disorder. Letter C, avoidant personality disorder. Or letter D, schizoid personality disorder.
Thank you, Deepika, for answering. Chris Yudi, you got this. Addy TL, you are the next Psych NP board certified. Larhonda, next passer. Lalala, next passer. Taylor Made, next passer. Victoria, next passer. Miss Barba, next passer.
Okay, the answer is we have mixed. Letter B. So both would involve fear of so social anxiety disorder and avoidant personality disorder would have it would involve both of criticism and social avoidance, right? But the key difference between two is the timing and the pervasiveness. So So, social anxiety disorder is fear of embarrassment, scrutiny, or negative evaluation in social situations. It may have a clear onset, and the person may function normally outside fear stimuli. However, avoidant personality disorder, it's a long-standing, pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to rejection. So it usually begins during early adulthood. No, early childhood, often with restricted or repetitive behavior. So remember, your social anxiety, there's usually a trigger, something happened. That's why that caused that behavior. And then avoidant personality, it's been like, it begins by early adulthood. So across multiple contexts. Remember, social anxiety, there's a trigger. That's why it's happening. Okay.
Thank you, Letty. So think about social anxiety disorder. They have fear of embarrassment, or they have scrutiny or fear of judgment. Your panic disorder, guys, sudden panic attack plus a future panic attacks, plus fear of future panic attacks. Agoraphobia, fear of
Of
places where
places.
we escape may be difficult. Avoidant personality disorder, they have pervasive lifelong pattern of social inhibition, inadequacy, and rejection sensitivity. While your autism spectrum disorder, hot topic, is an early childhood social communication deficits plus restriction in the repetitive behaviors. So they have stereotypical movements.
Look,
So
yeah.
think about that one. Social anxiety disorder, once again, fear of being judged in social or performance situation for 6+ months, causing avoidance or impairment.
Yes, Addie. So it's age of 18.
Mhm.
So no, conduct disorder, no. So it's actually your personal antisocial personality disorder. A conduct disorder, once they become adults, it's antisocial personality disorder. All right, it's
Yeah,
time for a raffle.
yes, time for ruffle.
All right, who's the winner?
Did you guys register? Only the ones that are registered will be the one getting it. Is my name there?
I don't see my name.
Is my name there? The Wheel of Fortune is coming.
Okay.
Woo!
All right,
Layla Chaned.
Leila Chanit. Congratulations.
Congratulations. Bravo.
Is Leila here?
Is Miss Layla here? You want to
Leila,
do
are
a
you
shout out?
here? Please write your I'm here on the comment box to know that
Yes.
you're
Is she
here.
here?
Because if you're not here,
Send us a message, Layla Chaned. Okay. Congratulations. So make sure, guys, you register. It's not enough that you guys are joining us from different live platforms. If you have a raffle, we're serious about it. And we want to make sure that you get the prizes. I think it's an Amazon gift card.
I
Who
want a
who doesn't
Amazon
like
gift
Amazon
card.
gift card?
I love Amazon.
Yes, and as you know, it's July right now. It's one of my favorite month
It's
because
his
it's
birthday
gonna
month.
be my birthday month. They said my wife is telling me you gotta celebrate your birthday for the rest of the month. So shout out to all the cancer out here, July babies. I feel you
I'm
guys.
June, but I'm Cancer.
Yes, cancer. Woohoo! And then don't forget about our classes if you like what you're hearing from us, if you like our strategies, if you want to spend more time with us, I think an hour is not enough. We have these two back-to-back classes that we have. July 7th to 10, 9 a.m. to 10 a.m. Pacific Standard Time. It's group live masterclass domain 1 to 5. So what are we discussing there? We go back to your basics. We do practice questions. We teach you how to take the exam correctly and put you in exam mode. But if you're a type of student like, I don't want to do domain 1 to 5, I want to do it a 1 day preparation, then probably July 25 will be for you. From 9 a.m. till 3 p.m. It seems like a marathon, Letty, right? But I think 6 hours is so
6 hours,
fast. It's
good.
like watching 6 episodes of your favorite Korean drama or watching concert shows. It's time flies so fast on that 1 day last minute prep for 6 hours. And there's a bundle out there. Thank you, Muhammad. There's a bundle out there, PMHNP review bundle. You save $50, scan the QR code. And once again, we thank you for choosing Pass Review Center. We've been around since 2015, Laddie. Can you believe that? This is
Yes,
like our
it's been a
this
month.
yeah. And then
Yeah, it's been
always
amazing.
making sure that you guys follow our social media. Tag your PMHNP best friends or besties for our PMHNP review, but I'm always emphasizing that we're not only offering Psych NP review classes, we also have FNP review, NCLEX review, launching BLS, ACLS pulse, and acute stroke or ASLS, acute stroke life support. That's also another thing that we're offering here. And CEU by the BRN California, BBNPT, and IV blood withdrawal therapy. So we get the whole shebang out here.
Yes, and thank you guys for joining us every day. Please help us grow our community so we can continue doing this. These sessions are free. Oh, there's a question.
Oh, there's a question. What
Yeah,
is the
how
question?
early should someone register for the LMR if graduating in December?
Wow, okay. Very good question. If you're joining us, remember we have like a 3 months timeline for you to
Mhm.
take the boards. So make sure you joining early is always not a bad idea, especially if you think that you're a type of student that wants to cover all the base. Sometimes you have a student that always wants to start early. That's good because they want to know everything while they're doing their clinicals, and that's a positive and proactive. But if type of person that wants to wait at the end, you're a crammer, it may be overwhelming and sometimes your head hurts. So make sure, guys, you plan ahead. There's a study calendar on our website. Please follow that. But always remember, we have question banks, on-demand review, one-on-one coaching, group coaching, and live free class that we're offering you guys. So please use it, and get the most of it because we're here in the service of you guys passing your board exam.
We need more healthcare providers. We need more psych and peace to like, build bridge the gap to access to care for our communities. And we really appreciate of your support. So also for those, we also have like other jobs, and sometimes, we try to squeeze in the live reviews whenever we have time. So just to keep posted of our when we're gonna be live again for these
Mm.
review sessions, go ahead and please subscribe to our mailing list so you can get posted. Okay, so you can get all the updates. Thank you so much for joining us today. We appreciate and we love to see new faces, like new names. And thank
Mhm.
you for your engagement and for your participation. We hope to see you soon again.
So remember, pastors, we're here for you. Please follow our social media once again. For Pastor Ladi and I are here to stay. Thank you for allowing us to grow our community. And if you like what you're hearing from us, please follow our social media
And
and
don't hesitate to share.
tag all your best friends. Click like and
Yes.
share, subscribe, and we're here for you. You are not alone on your educational journey. Sometimes we feel alone, especially during the pandemic. Like if your review program or if your classes are pure online, we want to offer you guys an in-person classes later on. So we're planning that this year. We did one last year, last June, right, Lady? You were part of
Mm-hmm.
our
I
cohort
was
for the
in
PMH and P
person.
Pride. And I think
Yeah.
some
With
students are
free food.
requesting, yeah, too much food, comma, but
I
some
enjoy
are
the food.
requesting, can we do another live class? Absolutely, yes.
Mhm.
Just let us know your interest and which city you guys want to hold it to. We're open to Las Vegas. We can fly out there, or we're open to Los Angeles, or we're even open to New York or even New Jersey. As long as you tell us what city you guys are on, and we can contact your school because we can talk to your directors and let them know that we can do a group coaching and you can try our service. And so far, we have a passing guarantee. Okay, you need to we make sure that we walk you through the process. Okay.
You got it. You got keep practicing. Like I said,
Mhm.
you'll never perfect the board exam, but you just need a passing score. Okay? You just need a passing score. Thank you so much for joining us again. I'm already checking my schedule because people are
Yeah.
requesting, when are you going to go live again? So I'm like,
They're
I have
asking
to
when are
check
we
my
going
schedule.
to go live.
Yes.
So
I'm
that
getting like,
brings us to the end of the PMHNP Lock It In Live DSM-5 night. So we have reviewed some of the most important DSM-5 differential diagnosis for your board preparation. Remember that board exam is not only testing what you memorize, it is testing how you think. And your biggest takeaway for tonight are timeline matters. Symptoms must match the pattern. Always rule out the substance, medical causes, trauma, and mood episodes. And when there are two answers that look correct, choose the one that fits best on your patient in the full clinical picture. And we are so proud of everyone who showed up tonight, Letty, right? Studying for the
yes.
PMHNP boards can feel overwhelming, but every session, every question, and every review brings closer to your goal. So keep showing up, keep practicing, and keep asking questions. We love questions, guys. We can talk for the entire hours. And you are building a mindset of a safe and a competent and a confident PMHNP. Thank you for joining us once again on behalf of Professor Leddy and I, Professor Pedro Morante. They call me Peter Morante from Los Angeles. We appreciate you being here. Mabuhay. We represent our kababayan. We raise our flag as Filipino American. Study smart, stay encouraged, and we will see you at the next live session. Let's lock it in. Good night, everyone. See you guys, passers.
See you on our next live. Good night, everyone.